No, so people will be watching from the platform. So they won't be joining the Zoom room. There is a Q&A on the right-hand side.
Okay.
Where it says something like join live Q&A now, which is an embedded Slido poll, which allows people to ask speakers questions. So if you navigate to the schedule and view the session, you will see when it goes live a Q&A.
Okay. So, but that is what I should point to the viewers to look at that and include their questions.
Yes.
In that, I may not be seeing it through Zoom, but it's there on their feed.
Exactly.
Okay.
Yeah, we got feedback from the panel session yesterday where very few people were using the Slido, and Cecilia was wondering if it was due to the fact that maybe they, it wasn't pointed out to them during the discussion. So that's why I told Emmanuel, or why she gave us feedback saying, please make sure that you mention it a couple of times during the session, that people actually activate that so that you get questions. Okay, so will automatically myself and Emmanuel and everyone else have hosting rights, or how does it work? Because I understand you guys are gonna disappear, right? The tech.
I think one of us will be staying on in the background. I think Emily will be, but yeah, we can certainly assign you co-host rights. So if there's so that you can kind of spotlight if you wanted to, but Emily can help with that. But who would like to be a co-host? Emmanuel and Hans?
Yeah, I think that would be,
yeah,
just in case something happens.
Yeah, perfect.
As you want to take that, and I concentrate on the moderating. Sure.
Yeah, or I take the co-host and Emmanuel just does the, yeah, sure.
I've put you both on there, and I think what we'll do is actually ignore that. Yeah, so you're both co-hosts, so you've got some rights there as well, so that's fine.
Okay. Do we have to click on this live stream thing now, or do we just ignore it?
No, you just ignore that. That's okay. That's just on there. That's just saying it's embedded into the platform, and as I say, Tom, that's all taken care of. So as soon as it's kind of our time to go live, it will go live. So just ignore that. Emily will press record, just so we've got an internal recording as well. So yeah, don't worry about any of them settings.
One point important, Hans, and just for the questions that will come to the audience. So I understand the box on the Q&A is we will not be seeing that, and so is there somebody bringing in the questions into the Zoom chat so that I can check?
And I can send you a link of where you can get that.
Okay.
The other thing, what Cecilia was proposing, that basically I would monitor because I'm not on the panel, but that I could monitor the Zoom chat, the Slido chat, and then basically copy and paste it into Emmanuel's Zoom chat, so that just he would get the questions, and then he could use the questions he wants to use, and not everyone, not the speakers would not get them basically. Only Emmanuel will get whatever it's posted in the Slido, and I would just have to copy and paste them over. I'm happy to do that if that would work.
Right, let me just post this in the chat, okay? So you've got to go, if you go to this link, you're able to see the questions that are coming in. Okay. For you, Hans. Okay. So right, just for the interpreters while we're in here, this is quite important to do just before we carry on. So Rania, Marie, can you go to your respective booths and
Hello, Tom.
Good morning.
Hello. So
can you go to your respective booths in Huddle?
Yes,
okay,
yes.
I'm there. I'm in my booth.
Thank you. Let me just go check that you're in the booth, and then I'm just going to do a quick test on each channel. So I can see, Rania, you're in the Arabic booth, and I can see that, Marie, you are in the French. Rania, can I get you to broadcast on Arabic?
Just a second, Tom. I'm logging from another device. Just a second.
Okay, I'll go with Marie first then. Marie, okay. Can I get you to check that and do a quick broadcast for me?
Yes, we'll.
Thank you. And it's just coming through.
Hello, can you hear me? That's in the French channel. Hello.
I can hear you. Your audio is quite quiet, but it's coming through. Can you carry on, Marie?
Is this better now?
That's much better. Perfect. Lovely. I can hear you loud and clear.
Can you still hear me? I'm trying to fix my microphone.
It stopped now, but I could hear you when you went, is this better? So the channel's currently offline.
How many languages do we have?
You have French, Spanish, and Arabic. So you have all the official movement languages.
Perfect, thank you.
Rania, are you logged in now? I'll admit Rania and Gilbert, because lovely. Good morning, Gilbert. Good morning, Rania again. So Gilbert, can I get you to navigate to the Spanish interpretation booth on Huddle, please? And
yes, I am already in on the Spanish booth in Huddle.
Perfect. Can you go live and do a quick test for me?
Yes, I am.
Make sure you mute your mic on this
Yep.
Zoom. Perfect.
Okay. I'm just having an issue with my mic. Hold on.
No problem. So I can see you're in the booth.
Yes, I am, but I'm error opening your microphone, connecting audio notes from audio contacts with the sample rate is currently not supported. I don't understand that because I have.
If you refresh your devices on that button on the left hand
Okay. Oh,
side.
sorry. I think I got it now. I have to switch my browser because I usually use Firefox, and I remember I have to go to Google Chrome.
Yes, please. Do go to Google Chrome.
Yeah. I'm taking care of that now.
Lovely. Brilliant. While we're waiting for you, I'm hoping that Rania is back in the Arabic booth, and we'll do a quick test with Rania. Are you there, Rania? Rania appears to have left again. I'm just going to send a quick message. Sorry, guys. You can carry on talking for a minute while I configure this.
Okay, Tom. Sorry.
Yep. Go up. Are you ready to test?
I'm in. I'm in now. I'm live. It's working.
Perfect.
So
let me go to the channel and test.
Yeah, I'm muting on.
Perfect.
Okay, Tom. Sorry.
Loud and clear. I can hear you loud and clear, Gilbert. That's perfect. No problems at all. So that's French done. That's Spanish checked. We're just on for the last one, which is Arabic. And it looks like Rania's left the Zoom room. Was it just? All right. You can carry on chatting for a second while I sort this with Rania. I'll take my microphone off, and if you want to talk any production rehearsal stuff, please feel free, and I'll just chip in to take over when Rania's back.
I would just have one question again. Cecilia yesterday recommended to spotlight. Unfortunately, I have a German version here. I think it says something different. Says focus on everyone or something like that. Is that what I should be doing in the background to make sure that just the speaker, or is it automatic that the person who's speaking is going to be on the live stream?
No, yeah. So if you want to spotlight your speakers, that will make sure that the recording and the live stream just shows exactly who you want. So if you're happy to do that, I can always support if needed.
As I said, I have somehow I have here the German version on my machine, and it says, so if I click on the three dots next to your name, right, and then it's the fifth, after pin, the fifth one, is that spotlight?
Yeah.
Okay.
Yeah, it should be.
Okay, and you can spotlight more than one. So is that how it works? And
yeah. Yeah, you can add or remove or replace. So okay. Yeah, you can have multiple people spotlighted if you want to.
Okay, I think it will be fairly straightforward at the beginning. I mean, the order, have you received, I sent, Megan asked me to send sort of the order of appearance. Did you get that? Were you in that mail?
Yeah, I've got that.
Okay, so I mean, that's basically just for the start. So, you know, it starts with Emmanuel, and then there's Ainur, and then Professor Muna, etc. So it goes through that order. But then afterwards, it's Emmanuel again who will pick it up and then basically play his role as a moderator, and then it will become more fluent, right? He will direct questions to different people. So then we have to be a bit more prudent and you know, and quick in spotlighting people maybe.
Yeah, sure. But are you happy to do that?
Okay. So you said, sorry, you are happy to do that? That would be wonderful.
Or are you happy to do that? I can't stay until the end of this. I can stay until 15 minutes before the session ends.
Okay. Yeah, no, sure. I can try. Yeah.
Okay. Well, just if you need to private message me when the session is going on, if you need some support, and I can definitely help out.
Sure. Great. Thanks a lot. I mean, we had asked for the other speakers to come in now as well, but none of them is here yet other than Ainur. So she managed. I just sent them another message saying that they have to go through this preview session link to hit, but Ainur managed to do that, and Emmanuel did as well. So I hope they will as well. They should be coming.
I think Martina might be here.
Okay. And then Robert should be there, and then Professor Muna should be there hopefully as well.
Can you see the waiting room?
Let me see.
Oh yeah.
Yeah, I guess Rama, that must be Robert, I guess.
Good afternoon, Hans. This is Professor Najmul. How are you?
Ah, very good. Good afternoon, Professor. How are you doing?
I'm fine. Excellent.
Good afternoon, Professor Nazmul. Emanuele Capobianco here.
Good afternoon. How are you?
Moderator for the session. Very well. How are you doing?
I'm fine. Doing excellent.
Can I ask you, just to be correct, how would you like to be named? Professor Nazmul, Professor Islam? What would be?
Simply Najmul. No problem. What's in a name?
We'll do.
Dr. Nazmul. That sounds good. No problem.
Thank you very much, and thank you for joining us. I'm going to ask the same to Ainur. How would you like to be introduced, Ainur?
Just Ainur.
Ainur.
I mean, if you want to say if you want to really try to say my last name, you're welcome. But I'll say it just in case.
No.
It is Kadı Hasanoğlu.
Test me. Try to tell me and then repeat it.
Kadı Hasanoğlu.
Kadi
Oh,
Hasan
Kadi
Oğlu.
Hasanoğlu. Yeah, it's a bit Turkish versus English pronunciation, but
Okay, I'll try my best. Kadi Hasan Oğlu. Thank you very
yeah,
much.
very good. Thanks.
And do we have Marina with us? Martina, sorry. Martina, I see you on the list, but we cannot hear you. We cannot...
She just said in the chat she has problems to start her video, but
Okay.
can hear us.
Okay, good. Thank you.
It might be worth maybe leaving, trying again. We'll admit you again. No, we can't hear you.
In the meantime, just since she can hear us, just to recap the flow, we will start the session with some introductory remarks, very briefly, just administrative remarks on how the session will run, and then we will I will give the floor to Ainur for a presentation on the study. And that would be a 5 minutes presentation, more or less. Ask you to try to respect the timing as much as possible. And then we will go into 3 rounds of intervention of 5 minutes each. Will be first Professor Nazmul, then Martina, and then Robert. And after that, we will start taking questions from the audience. I will try to moderate the questions and divide them among yourself. I really look forward to an interactive session if we can. Otherwise, I will start bringing up, Anse and I will start bringing up some questions for you, but I really hope we will get questions. Is that clear? Is there anything clear? We see you, Martina, now. Can you try maybe to speak? Seem to be on mute at the moment, Martina. But
now, can you hear me now?
We do perfectly.
Ah, okay, thank you.
Thanks for joining us, Martina.
Happy to be with you. Thank you for your patience.
And now we lost you though, Martina, in terms of audio. It just faded away.
Yeah, it's not the best microphone now. I will change it.
Now it came back perfect. So
Emmanuel, there's an Eva and a Rama in the waiting room. Are they part of the speakers or?
Eva Graf, GIZ, I think is in support of Martina. So I definitely think that we can admit her in. Rama, I'm not sure.
Oh. Okay, that's fine.
Okay, perfect. I'm going to disable the join button now from the page, so other additionals. We go live in 5 minutes, by the way. Can I just confirm that everyone that we think should be in this room for this live stream is here now?
Yeah, can we just ask Robert to turn his camera and try his video?
Yes, certainly.
There he is. Good morning, Robert.
Morning, Robert.
Morning.
And sorry, did you say that Eva was part of the group? Eva.
Martina, we can ask you, do you want Eva Graf to be admitted here among us, or she will be joining the bigger session? She's from GIZ.
She will join the bigger session then. Mm-hmm. Thank you.
Perfect. Okay, so we have, just to confirm, final time, we have everyone here that should be here for this speech and this live plenary. Perfect. Right. I am now going to remove the button for additionals to join back into the space, and we will remove Eva and Rama from the waiting list on the waiting room. We will go live in just under 5 minutes now, so I will give you another little shout a couple of minutes before we go live. Brilliant. Thanks, guys.
Thank you, Tom.
Thank you.
So I just briefly briefly went through the run of the session. Is there any questions around the plan for the session from the speakers? I will try to post them in the Zoom chat. I mean, Hans will send me some of the questions will come. I will curate them and then bring them in the Zoom chat for everybody, the ones that are coming up, and then either I'll ask who wants to take one, or maybe I'll assign based on my understanding of your presentation, your entry points, if that is okay with you.
Emmanuel, just a quick point. Unless we have an expert among the panel, since I don't know them all, about climate change and health and COVID, because there's a lot of discussions in the press, unless there is an expert. And if there comes a question, I'm happy to help. Not that I'm an expert. Again, just in case, you are also welcome and maybe probably more qualified than I am. But in case needed, I'll be happy to say a few things.
Thank you. So what we do have is to have, of course, the Red Cross represented by you, Ainur. We do have the Professor Nazmul representing the government's response and the experience from Bangladesh. We have Martina representing GIZ with, as I understand, a strong focus on programs around cities. And so to take that, and then we have Robert, which is a huge expertise in terms of CSO's representations. It's been demand generation for COVAX, a lot of experience from Africa in countries. So I think we have a fantastic panel.
Excellent, then you won't need me. Great.
We'll need each one of you. Robert, just to check with you, your last name is Kanwagi or Kanwaji?
Kanwaji.
Kanwaji, okay.
To which one?
All right.
Right,
yeah.
Perfect. We're going live in let me just reload the page and I'll find out for you in just under a couple of minutes. Just to let the AV support know, so that's Jen or Emily there are going to be some interpreters who are leaving the previous session, joining the room. So they will go into the waiting room. So if you're a co-host and you see someone such as Helena INT at the end of their name, INT stands for interpreter, can you let them in the room? I'll stick around for the first 5-10 minutes to make sure that they can get in, as they will take over from their partners. But yeah, just to make everyone aware that there will be a few people joining who are interpreters.
Maybe just a question from my side, if I may.
Oh, we have 30 seconds, so really quickly.
Emmanuel, just in case during the open discussion, I would like to raise my hand. Shall I do it via the Zoom hand up, or just like this?
Or the chat. Raise your hands or the chat. I'll be there.
Okay. We'll be fine.
15 seconds and you will be live. 7, 5 seconds, 4, 3, 2, 1, you'll be live.
A very good morning, good afternoon, good evening to all of you from Geneva. My name is Emanuele Capobianco, and I'm delighted to be the moderator today for a session about the response to COVID-19 in urban settings. We have a fantastic panel with us, and I'll be very happy to introduce the experts that are joining us to bring a different experience on the response to COVID-19 in urban settings. We have representatives from different parts of the world, from different course of lives, and so will be certainly a fascinating discussion. The session is being recorded. For you to be aware, the session is being translated in French, Spanish, and Arabic. We want to invite you from now on to start bringing up your questions to the panelists in a button that you should have on the right hand side of your screen. Is a join live Q&A button. We want this to be a very interactive sessions, and so please bring in the questions as they come to your mind, and then after the introduction of the various speakers, we'll come back to them with your questions and hopefully with good answers. The way this session will be organized, we are going to have a presentation by our first speaker about a study that has been conducted by the IFRC and the German Red Cross on COVID-19 response in urban settings. And then we'll have 3 statements, each one of around 5 minutes by the 3 other speakers. After that, we'll open up the floor for your questions and what I hope will be a Q&A lively session. So before going to Ainur, who is our first speaker, I just wanted to thank personally the organizers of this meeting for inviting me. I am the director of the WHO Foundation, director of programming, but I am the former director of health in the IFRC. So it's for me an enormous personal pleasure to be back in the family. And no better way to actually move into the next speaker, who is the previous senior urban advisor, the global level in IFRC, and currently the senior advisor on climate and extreme heat for the American Red Cross Global Disaster Preparedness Center. Ainur Kadia-Sanholu is with us today. She has been really instrumental leading the urban disaster risk reduction and preparedness work at the Red Cross in the network over the last decade. It's a pleasure, Ainur, to give you the floor to present the study that we'll be discussing today and get us going. So over to you.
Thank you so much for the introduction, Emmanuel. It's a pleasure for me too. Let me share my screen quickly. All right, and start the presentation soon. As you mentioned, this study that German Red Cross with IFRC carried out last year to find out how the national societies responded to COVID-19 and what are the implications for our future work in urban. So I think with well over 92% of the cases happening in urban areas, in cities, I think it's fair to say that COVID-19 has been and indeed is a urban crisis, urban health crisis. So I'm sure my fellow panelists will touch upon the impacts of COVID on the society, on people, on health, and other aspects. So I'm going to jump straight into the urban consideration, the impacts for our work in urban. So this, first of all, this study has been, let me just move this. This study has produced 2 outcomes. One is a literature review on epidemic and pandemic response in urban areas and what we learned. It's a desktop review. And the other one is more specific on the national society response. And you see a QR code there. You can scan it and you can have access to the report directly in preparecenter.org. So let me just go to the next slide. Oops. I don't know why. Okay, here we go. So we actually learned a lot as national societies from this crisis. And I do hope that will inform our future work in terms of climate change adaptation, disaster risk reduction, not just response. So you will see more detailed lessons learned and how national societies responded in these reports. So I want to just touch upon a few points. The first one is that it showed that existing strong branch presence in urban areas, which is, I personally believe, much wider and spread out than it is considered internationally. Internationally, we think that we are more focusing on rural, but we have quite a strong presence in cities and towns. And that proved to be a very key in mobilizing the volunteers, mobilizing response, connecting with local governments and communities. But one thing is that some nation societies found out that they don't actually have that strong presence in informal settlements and slum areas. So that was a big lesson to learn, since their own targeting and identification of vulnerabilities, assessment studies, and show, and as predicted, these densely populated areas, mostly lacking basic infrastructure and services, were the epicenters of this disease, and they were not that present existing, but that forced them to go into these areas and recruit volunteers from these areas, try to understand the needs and focus their response, which is something we hope that we can leverage for our future work. These are areas definitely need our attention in terms of disaster risk reduction and also climate change adaptation. The other lessons learned is that obviously nation societies have this connection, auxiliary role, connection with national governments, but it's not always the case that they have this role clearly identified or mandate clearly identified when it comes to health emergencies. So that also proved to be something that we need to look at and rethink and maybe strengthen, because the nation societies obviously have to work with local authorities in cities and towns. And this rethinking the auxiliary role, bringing it down to city level, local government level, maybe strengthening these roles in the city emergency response plans, contingency plan, health response plans, is something we need to think about for future as well. And that is, again, a very crucial thing for our other types of work as well, not just pandemic. The other lesson learned is that we see that a lot actually in many disasters, in urban areas especially, surge of volunteers. People want to help, people self-organize, they immediately form their own groups and also come to Red Cross and national societies to help. But a lot of times we are not equipped, or nation societies are not able to manage that kind of a surge, that kind of a huge onboarding, fast onboarding of volunteers. This happened during pandemic too. And but another part of it was that this surge had to be also managed digitally, remotely. So, and we saw that a lot of nation societies immediately responded that they developed these digital new tools, and but that's something we need to think about, like, because this will happen in every crisis, because of the scale of the, not just because of the scale of the affected people, number of affected people and affected regions, but also the number of people who wants to help in urban areas. They are very resourceful. So are we ready for that, for responding to that kind of surge? But we learned a lot, and I think we hope that we will develop our fast track onboarding of new volunteers for disaster response, but also for other work. That requires, I think that's very closely related to the digital transformation work that's been going on within IFRC, and we hope that that will be taken into consideration. The other thing that is very interesting is that obviously we are all aware that pandemic affected the socioeconomic impacts of pandemic. But while there's a lot of people employed by government, military, academia, or companies formally in cities, there's a huge chunk of informal sector. This informal sector is much bigger than probably we all think. It can go up to 80–90% of the city economy in some cities in South Asia and Africa especially. So that's a huge, vital part of city economy and people's livelihood. But this is an area we just starting to understand and how to link with. And I'm happy to say that there is some work going on within Red Crescent, but it was a little bit surprise to us, to be honest. Like, that was not something we were paying that much attention. So national societies were kind of forced to look at that. Like, people lose their jobs, but also how to help them when they are not part of the formal protection systems, and it's hard to find an employer to connect with. Not to look at the formal sector, but that's a little bit easier partnering with governments and companies. But this informal sector proved to be really crucial, and these informal sector workers are also very crucial in any disaster response, in any disaster recovery. They are the ones who not only affected most, but also immediately they can come back to life because of their flexibility and help with the recovery under any crisis or disasters. I'm trying to go really fast, but really I would invite you to look at these studies because there's a wealth of information there. The other point I would like to make is that, of course, we talk a lot about stakeholder mapping, but this is something we need to do pre-crisis period. Obviously, we need to understand who is who, but especially pay attention to these community leaders. I mentioned these informal settlements, they are huge, but there are also so many hidden community structure in these areas. And they're not that visible to us. I mean, when we look at them, maybe from an outsider, we might see a little bit chaos, but it's not actually. It's very well organized, but it's differently organized. So that really requires understanding the community networks, community leaders, and connecting with them. They are the ones who help most to nation societies to develop messages, to reach out to these communities, to find solutions. Not just during pandemic again, but for our future work as well. So understanding these formal, informal networks and traditional leadership roles is really important. And this is also very much related to the combating misinformation. That has been really important during this pandemic. But I think it's very easy to relate to that in many other crises and disasters where there's so much information coming and people are struggling to believe in what. And also we are combating with the time. Things are moving very fast. People are, even within a city, in a normal crisis, they move fast. But during pandemic, this misinformation proved to be a really key factor as well. And again, I will link it back to understanding these structures and connecting with community leaders. I'll stop there and happy to answer other questions. Thanks, Emmanuel.
Thank you, Ainur. Wonderful presentation, and you condense a lot of information from the study, which is available. The link is available on the chat and available on the platform, and I really would recommend that you look at it. I just wanted to mention one point from your presentation is a lot of the learning that are coming out of the COVID emergency or health emergencies can be applied for other disaster and crisis, can be applied to the challenges of climate. So we are really taking this coming out of an health emergencies for the future. A lot of points will come back in the Q&A session. I remind everyone, start putting your questions to Ainur in the box at the bottom of your screen, and we'll then respond after we have gone through the first round of interventions from our speakers. And the next one, I'm delighted to welcome Professor Nazmul, who is is coming from the Ministry of Health and Family Welfare of the Government of Bangladesh, where he is the Director of Disease and Communicable Disease Control. Professor Nazmul is a professor of otolaryngology and a public health specialist who has played a critical role in the COVID-19 pandemic response as director and spokesperson of the Director of General Health Services in the Ministry of Health. Dr. Nazmul is a professional with a lot of experience, with many publications in several international and national journals. He is also an interesting person with interest in sports, Bengali literature, and teaching. I'm not sure we're going to be able to talk about Bengali literature, but for the rest, Professor Nazmul, the floor is yours. And once again, welcome and thank you for joining us today.
Thank you very much for giving me the floor. Good afternoon and warm greetings from Bangladesh. Happy to see all the learned panelists, distinguished participants. I'm very happy to join this panel discussion, and the participants all over the globe. Thank you very much for allowing me to say a few words. And I'm very happy to be present as a panelist in this 2021 Urban Collaboration Platform COVID-19 panel. We all know that the novel coronavirus outbreak, which began in Wuhan, China in December 2019. And it has expanded to touch every corner of the globe. Millions of people around the world have been affected, and hundreds of thousands of others have died. As soon as the news of this COVID-19 outbreak came to us through World Health Organization, we started working on its prevention in Bangladesh. I would like to give a short account of what actually we have done in that period and what actually we are doing now. And then I will point some of the important points regarding our national society. Actually, we started National Preparedness and Response Plan for COVID-19, which was prepared on the late February 2019 by the experts of our country. We established and strengthened surveillance capacity nationwide for the detection, reporting, and monitoring of COVID-19 cases, including requisite laboratory capacities. We also ensured a continuation of essential healthcare delivery and nutrition services, including routine immunization program. We also enhanced infection prevention and control mechanism in the healthcare settings and in the community. To slow the rate of community transmission and prevent amplification events, we communicated critical risk disease information and best practices to the communities, and we took countermeasures to address misinformation. You know, the first case was detected on March 8, 2020, and the first date was recorded in 18th March. After that, we started focusing on promoting social distancing using a mask, closure of schools, universities, colleges, and all other educational institutions, closure of all offices, government and non-government markets, and we restricted and almost banned inter-district travel. Infection prevention control training for the healthcare workers, we all started, and a guideline was developed. More than 20,000 doctors were trained on COVID management and IPC. We also started central hotline system to identify suspected cases. We also enhanced the telemedicine consultation using different toll-free numbers. More than 32 million consultations provided till yesterday. And cleaning of public places, roads, especially in the urban areas, Red Crescent supported us in this regard, a huge support. Later on, we focused on increasing the numbers of labs, sample collection kiosks were installed, test report to patients were sent via text messages, via email. Central database was established for logistics management. We also initiated the zoning quarantine system to avoid lockdown the whole of the country. We also developed clinical guidelines, which was updated regularly, and training of the healthcare workers was going on accordingly. We had some problems with oxygen supply, increased oxygen demand for the patients, and we started struggling with the increased demand of oxygen, and we started to begin to increase our capacity, and now we have a sufficient oxygen supply capacity so that it can cater our demand. Many activities of COVID-19 prevention, you know, is that the vaccination, and we started our vaccination activity in 27th of January this year. And it was very difficult for us to procure vaccine, to get vaccine. It was a huge challenge. And also management of vaccine transportation, vaccine storage, etc., etc. At that time, Bangladesh Red Crescent Society also came with their volunteers to help us in the vaccine campaign and communication support, transport support, etc., etc. And after passing all these months, we can now say that we have sufficient, to some extent, enough lab capacity. We have enough hospital beds, enough logistics to maintain the future waves, if that wave is little different from the previous ones. We can establish, we have established health screening mechanism in every port of entry of the country, airport, seaport, land port. We also have steady supply of vaccines right now from COVAX facilities from China and other development partners. But still, it's a long way to go. We just vaccinated about 30% of the population of our country. Motivating people to follow safety measures is also very challenging. However, the support from the civil society development partners, including Bangladesh Red Cross Society, Red Crescent Society, is excellent. With everyone's support, we believe we will be able to overcome any outsurge of this pandemic, any wave. We can overcome this. And recently, the Bangladesh Red Crescent Society, the partners, the German Red Cross, one of the partners of our national society, BDRCS, they have started on humanitarian assistance in urban context, responding to COVID-19 in urban environments. Actually, this study on responding COVID-19 in urban environment was commissioned by the German Red Cross through funding from the German Federal Foreign Office. This report forms the final of the two outputs produced for the study. The first was a literature review on learning from the epidemic and pandemic disease outbreak response in urban environments. This report focused on second output of the study, which examined the local response to COVID-19 in urban areas and draws lessons for future response. This study used three main data collection techniques, which includes the document review in a comprehensive online survey and key informant interviews. And an analytical framework was also used to answer the main questions for this part of the study. How did national societies position themselves in the response to COVID-19 in urban settings? From our experience, what we have seen for the last about 2 years, Bangladesh Red Crescent Society, what they have done. They contributed a lot. Some of the highlights I can tell you. Infection prevention and control activities have been conducted in 16 COVID-19 dedicated hospitals in Dhaka with collaboration of the BDRCS. The Holy Family Red Crescent Medical College and Hospital started dedicated COVID-19 treatment center to support government's program. Bangladesh Red Crescent Society supported government's vaccination campaign from the very beginning in urban areas particularly, and to some extent some of the rural areas. And they successfully participated in the awareness campaign. They established sample collection booths. They provided with emergency food support to the quarantined people. They served cooked food, which was distributed to the urban slum dwellers in Dhaka and other city parts of the country. They also provided support with the IPC training to the cleaners of the city corporation. They also came forward with the purified drinking water in different public offices, hospitals during strict lockdown. And they are still working with the vaccination campaign, which is a very successful story in context of Bangladesh perspective. And as a whole, they are working in a very close collaboration with the government mechanism. Red Crescent youth volunteers and other youths, they are working together, and they are the key player of this national society along with all dedicated staffs of the Bangladesh Red Crescent Society. And of course, they are getting support from the international organizations. And BDRC has contributed to the government of Bangladesh, and we believe this support will continue in the days ahead of us. As a whole, during this pandemic, the economy, the livelihood, the environment, everywhere we had challenges. At the beginning of the pandemic, we didn't know what to do, but very quickly we started finding out the problems. We started giving the solutions and sharing experiences. And then I believe sharing and caring, as it is a global village, if we work together, we can come up with better solutions. And whatever the situation might be, if we work together, we can save the humanity, we can save ourselves. Thank you very much for giving me and allowing me to present. Thank you very much. Thank you all.
Thank you, Professor Nazmul, for this presentation. It's heartwarming to see how you move from everywhere we had challenges to such a comprehensive response, and it's fantastic to see how the Red Crescent was able to support that in so many areas. I have plenty of questions myself. We'll keep them for later, but thank you for this presentation. Really critical. And again, put your questions into the chat. There are already some coming up. We want to have more for a lovely discussion. Before going there, I would love then to give the floor to Martina Lieberman. Martina Lieberman is the head of program for sector program cities in GIZ. She has been working with GIZ since 2010, and she has vast experience on urban development and development cooperation with the Global South. Martina, thanks for joining us, and the floor is yours.
Yes, thank you very much, dear Emmanuel. Dear panelists, dear guests, thanks to you all, and thanks to International Red Cross and Red Crescent Society for the opportunity to speak on this panel here today. As I was nicely introduced, I'm the head of the Sector Program Cities. And just to let you know, Sector Program Cities consults the German Federal Ministry of Economic Cooperation and Development on the topics of urban development and planning, municipal finance, climate, and also urban resilience. So on behalf of the sector program cities, I would like to stress out our perspective on COVID-19 response in cities and bring some ideas and experiences to this panel discussion. So, as it is obvious, working with cities the past 1.5 years have been quite a journey, also for us. As you are all aware, COVID-19 has affected cities and international institutions around the world in an unprecedented way. Particularly city governments and citizens have faced significant challenges. So to mention here that city governments, for example, had to shift their attention to short-term pandemic management and restrict economic and physical mobility, often leading to losses of jobs, particularly in the informal sector, and as it was mentioned before already, specifically in informal settlements. So further, local governments were confronted with strained municipal budgets as social spending rose while revenues fell, leading to further increased debt and reduced fiscal space to provide basic services for citizens and to implement sometimes even already planned measures to reach the sustainable development goals. In this context, the pandemic has of course also impacted international development cooperation and agencies, including GIZ, and our ability to implement programs, as we had to swiftly react to new circumstances and challenges on the ground and in the partner countries. This has meant many open questions, new experiences in the cities, and new thinking and approaches in our projects. So within GIZ and in the urban community, the concept of green recovery has gained extreme momentum, and some development agencies and international organizations quickly made the case for a triple divided approach. So firstly, to react directly to the needs in and after the pandemic situation. Secondly, helping cities boost their economies while improving equity. And thirdly, preparing communities for inevitable climate and health threats to come. So against the backdrop of the pandemic, BMZ, our commissioning ministry, and also BMU, the Ministry for Environment of Germany, have released special COVID-19 recovery funds for cities to develop first solutions to these challenges and to react to the multiple crises caused by the pandemic. So many projects of GIZ have received additional funds out of these before mentioned special COVID-19 funds to provide cities with ideas for sustainable transformation. In our case, in the case of the sector program cities, we also were commissioned by BMZ to implement the Resilient Cities Action Package. For short, I will call it in the next minutes Recap 21. And the objective of this program, which was limited for implementation within 2021 only, was to enable selected cities in 3 countries to implement plans and measures for a resilient recovery from COVID-19 pandemic. So the 3 countries for the implementation of Recap 21 were Mauritania and Bangladesh and Rwanda. And we collaborated with partners to successfully reach our goals. The partners were ICLEI and the Resilient Cities Network. So we used also their structures and ongoing projects, and the measures reached in this program from short-term implementation of small-scale measures, as well as capacity building for the pandemic response, to developing long-term resilient plans. So many core messages we now heard from the study of the which was just presented were also of great relevance in our work as well. So the focus on partnerships for disaster risk response corresponds very strong to our way of collaboration with our partners within the program Recap 21. We can also underline the importance of the multi-level coordination in cities, but also with the national level. So furthermore, working with cities, we use a cross-sectoral approach, which is even more important when it comes to such complex challenges as crisis response and disaster risk reduction. So our role as GIZ generally is to strengthen cities and their contribution to sustainable development. For this, we want to strengthen city systems to become more resilient. And within the Recap 21 and our response to the crisis in cities, we move between direct humanitarian aid and longer-term development cooperation. Whereas the latter, so the long-term development cooperation, is our general mandate, we also wanted to include direct and rather small-scale short-term COVID aid measures. So in this respect, we had and still have some questions which arose during the project preparation and implementation. For example, how to collaborate best in these circumstances when a crisis is still ongoing. How sustainable is humanitarian aid as such? And where does then development-oriented emergency and transitional aid begins and where does it stop? So how can it best be interlinked to reach the best results? So these, for example, are some questions I'm very keen to further discuss with you. And with this, thanks a lot for your attention, and back to the moderator.
Thank you very much, Martina, for this important question that you're raising around the link between humanitarian and development and the sustainability. And thanks to the German governments for the investments in these three countries and with the idea of bringing new thinking and new approaches and really building better with the future. So thank you for that. Again, lots of questions that I'm sure will be coming up, Martina, during the next session. We'll move to the Q&A in a few minutes, but before, I have the pleasure of having with us Robert Kanwaji, who is the COVID-19 vaccine demand generation lead for COVAX in Gavi. And Robert is a health specialist that has 2 decades of work in different African countries, working on developing and managing community-based public health programs. So I'm very keen to hear his voice. He's been also the CSO representatives to country readiness and delivery demand generation technical working group, and now the COVAX demand generation focal person based in Kenya. Robert, we at the Red Cross, Red Crescent are very much a community-based organization through our volunteers. We are very keen to hear your views on something that came out of the report, of your own personal experience during this COVID-19, and any suggestions, reflections that you would have with all of us in the audience. Floor is yours, Robert, and thank you.
Thanks a lot for that introduction, and thanks to my fellow panelists and to our participants. I'm going to focus my submission on Africa, just to show you what we have been doing. As we all know, Africa is currently experiencing the most rapid urban growth in the world. Between 1960 and now, the population in the urban settings has increased by 10 times. Africa only had 53 million people living in the urban areas in 1960. Today, it is 588 million people. That's a huge number in terms of increase in the last 6 decades. There is a new report that has just come out which shows what will be the 10 most populated cities in the world by 2035. And you cannot be surprised that 5 of these are based in Africa, with Lagos being tipped to be the most populated city in the world by 2035. So what has happened in the last 2 years, as we all know, that COVID has hit us greatly around the world. So are the cities within Africa. We know that many of the cities in Africa are not well planned. They host both formal settings in terms of housing and a lot of slums. 47% of Africa's urban residents don't have access to basic sanitation services and hand washing facilities, which are very core in prevention of COVID-19. When you look at hospital beds, you're talking about 1.8 beds per 1,000 people in many of these cities in Africa. So the risks that can promote the spread of COVID-19 are greatly present in many urban cities in Africa than you would say in the rural areas. I live in Nairobi. Nairobi is one of the cities in Africa that has huge populations during the day. A lot of young people who are unemployed leave the rural areas to come and settle within the urban cities. 71% of the Africans are making their trade or livelihood through the informal sector, mainly again through the urban settings. So we can see that the cases of COVID-19 are higher in many African cities than they are in the rural settings. A good example, we can look at Uganda, Kampala, where since the start of the pandemic, it has been the city with the highest number of cases, always number 1, irrespective of how much work you do. This is because it is also a transit center of trade, but also houses a number of people from the greater metropolitan surrounding the city that are coming to work on a daily basis to look for livelihood. And even when you look at the number of COVID-19 cases around Kampala, the capital city of Uganda, again, the districts or the cities or the towns that follow it in terms of number of cases are those that are nearest to it. So urban centers or cities are areas of great concern. If we are going to eradicate or manage and minimize the spread of COVID-19, then it is very critical that we deal with the epicenters of this disease, which is mainly urban cities, urban slums, where there is a lot of interaction, where there is limited sanitation, hand washing facilities, where accommodation is a big problem, more than 8, 10, 15 people staying within the same household. All these facilitate increase in the number of people who get COVID-19. So what have we done on our side in supporting countries to minimize or to reduce the impact of COVID-19? So in this regard, I'm going to speak mainly from the vaccination perspective, but COVAX and the Ugandan government, I'm going to take a case of the Ugandan government and the Kampala city and elaborate what we have done. So there are basically 3 things that are happening that we are doing in the urban settings in partnership with the Ministry of Health in Uganda, the Kampala Capital City Authority, which is the authority responsible for the management of the city, and the private sector, and of course the other stakeholders that live in the city. One is to increase vaccination touch points across the 5 divisions of the city. 2 is mobilization, and then 3 is increasing the healthcare workforce. So in one, what we have done with the Ministry of Health is to map out the conducted targeted outreaches to potentially high-yielding workplaces, markets, tax parks, industrial parks, garages, timber stores. All these house a lot of people during the day. So these have now been turned into outreach vaccination centers, where a team of a vaccination team of counselors, the vaccinators, sanitation, peer educators, all come up into the team and make an outreach, talk to the communities within the garage, within the industrial parks, within the timber store yards, within the tax parks, the markets, and then motivate them about the benefits of taking the vaccine, and then they get vaccinated there. The second thing we are doing under vaccination is targeted outreaches to places of worship. We know that Africa has about 72% of Africans are Christians. So, and another huge percentage, more than 20, are Muslim. So this provides us an opportunity of every Friday, every Saturday, and every Sunday, where we have evangelical churches which assembled Monday, Tuesday, Thursday, Friday. I mean, we have 7 days of work for us to reach people with vaccination through worship places. And this has yielded a lot of people turning up to be vaccinated. The second thing we do, which should have been my number 1 in terms of discussion, is mobilization. This one we have worked with the private sector, because you know that the private sector basically runs the cities in terms of restaurants, in terms of soft drinks, bars, in terms of beauty centers, in terms of supermarkets, talk of anything they do. They have resources. And remember that part of the interventions that the governments have taken is locking down cities. So it is in the interest of the private sector to work with the government to get people vaccinated so that they can open up the city. So the private sector has been very instrumental in supporting demand generation by doing the adverts about the benefits of vaccines, by doing messages, where can I find a vaccine next to me, to people, for instance, telecom companies are part of this. Actively engaging their social media platforms and their social media staff and gurus who are on their payrolls to use their Twitter, Facebook, WhatsApp to reach out to communities about vaccination, using their mobile vans, which they used to market their beers and sodas and telecom products, but now they are using them to market vaccination. And of course, supporting the bringing together of celebrities that they have on their engagement lists, whom they used to promote their products. They are now using them to promote vaccination. So that has been a great return in terms of working the private sector. The third thing that I'll talk about is the human resource. We all know that we have a deficit on the African continent of 200,000 healthcare workers. If we are to meet the vaccination target that COVAX has set and WHO on the continent, 20%, 30% by the end of 2022, we need 600,000 healthcare workers, because you need the healthcare workers to do the vaccination. So if you don't have them, then you can't vaccinate. Now, that deficit of 200,000 is calculated on the basis that the denominator are those that are hired and work within the mainstream healthcare service. Not those working for prisons, not those working for the military, not those working for the private hospitals, etc. So one of the things, again, we are doing with the urban centers is to bring upon the infrastructure of the military, the prisons who are within the urban centers, so they can put more healthcare workers to this space. So those are the three main things that COVAX and the Ministry of Health are doing to champion vaccinations within the urban center. Thank you very much.
Robert, thank you very much. I love this presentation. I've moved from the Red Cross into a foundation that is the WHO Foundation that works to strengthen the linkages with the private sector. So I'm kind of sensitive around that. If I can start from this very point with the first questions, I would go back to Professor Nazmul to just have his views about the experience of Bangladesh in interacting with the informal sector, the private sector in their response, just to see whether what you have experienced, Robert, in Africa is mirrored in Bangladesh or not. So, Professor Nazmul.
I didn't get you. Can you repeat the question, please?
We would like to hear what has been the experience of the Bangladesh government with the private sector engagement for the response.
Yeah. From the very beginning, intersectoral cooperation was beautiful, and the government of Bangladesh involved international NGOs, national NGOs, development partners, and the National Pandemic Preparedness Guideline, which was drafted in February. During preparation of this guideline, the people were involved with all these activities. And from the very onset of this COVID situation, all the development partners, NGOs, international NGOs, and other private sector entrepreneurs, they all came forward to support the government. That's why we were able to contain this pandemic very beautifully.
Thank you very much, Professor Nazmul. One of the, and I once again, I would like to invite our viewers to put their questions into the box for the Q&A. I am collecting some of the questions, and I will continue bring them to our speakers. One questions that I have for Martina is about the interesting approach to integrate humanitarian and development work that you spoke about. And you mentioned about the engagement in 3 countries, Mauritania, Bangladesh, and Rwanda. What are the first experiences, the main challenges and fundings that you have so far and you could share already with us?
Yeah, thank you very much for this very important question. I mentioned that the period of implementing this RECAP 21 program was limited to the year 2021. So this is a challenge as such, because then you need to prepare the program and implement it in very short time. And this, in addition, we wanted to do something which really helps at the local level. So to help to deal with the pandemic situation. So this needed also that we learn about the situation there. And that's where our cooperation with our partners I mentioned ICLE. This is the local governments for sustainability organization, and they have also people working on the local level as well as from the Resilient Cities Network. So we took the strengths of all our partners together and their knowledge about the situation through their locally experiences. And so I think we could find good measures, but still the main constraint was a time frame. And what I mentioned before also, you like to do something good, and of course you would like to achieve an impact also, but to really have the local partners also in the state that they could react and that they could digest. So this has all go together well, and and normally what I mentioned, we work in our projects as GRZ on a longer term perspective. So that was quite a challenge.
Perfect. Thank you very much. I have a question for Ainur. Ainur, you talk about the volunteers and the surges that actually were required in volunteers. Could you share a little bit more about the, from the study and from your experience, what were the opportunities and challenges that happened in urban settings vis-a-vis this surge of volunteers? Because the issue of human resources, as Robert has mentioned, is critical during a pandemic. And on one hand, there is an increase in solidarity that is very, very, very positive. But on the other hand, there are challenges in just managing the human resources in a context of an emergency. So any reflection on that point, because I think we'll speak to many of in our audience that come from the Red Cross or Crescent.
Yeah, sure. That's a great question, Emmanuel. I think this is very much related to what we are discussing quite a lot when we discuss about any intervention in urban, which is what is our role actually. In urban settings, we may not be always the main, even one of the main direct service providers. So that proved to be the case, right? I mean, there are so many self-organized communities, there are social networks, informal networks, and people belong to many different networks, and they get immobilized. And so what is our role? Like, maybe we need to have a role of connecting these networks, like helping these networks of help and support do their work better. So that requires a totally different thinking, actually. Moving from a direct service provider role to a convener role, a connector role. That is proved to be the case for pandemic, but I truly believe that it is the case for any disaster or crisis, mainly because there are so many resources, and we should see the urban populations, urban group as active agents of change. They are capable of mobilizing these resources. But we need to get better at understanding, and of course, pre-disaster or crisis situations, connect with them and see how we can help them to do their job better. That would be my answer. Thanks.
Thank you, Ainur. I'm very, very impressed by the breadth of experience that have been shared and what has been learned so far. But I'm realizing we are not yet out of COVID-19. So I wanted to bring back to the panel, giving surges that are happening right now in countries that may be moving to other continents in the future, and thinking about where we are with the level of capacity for preparedness for the next waves. I would like to hear what is missing? And I will again go back to Robert and Professor Nazmul, maybe to have your perspective from the countries. What is missing? What has not been focused enough? Where should we be pushing, all of us? And I would also say our national societies. Robert.
I think for me is awakening the community health system within the urban setting. I think we have done well with setting up good community health systems in the rural areas of countries, but not done a tremendous job in doing community-based health systems in the urban setting. For instance, it is common to find community health workers in many rural parts of Africa, but extremely difficult to find them in the urban center. For instance, we know that there are many young men employed in garages and timber stores. Why don't we have community health workers within those audiences? Why don't we have functional community health work structures within or peer education programs within the slum areas? So I don't know whether it is just a bias, but we always tend to think that urban areas have better services and access to services, especially health services, than rural areas. Therefore, usually don't find good justification for people to fund urban programs previously. So many of us focus on the rural areas. So I think during this COVID pandemic, one of the things we are learning is that urban areas have not really had good community-based health structures, and awakening that structure to ensure that we have a last mile group or front mile group of people that engage and live with the urban dwellers and know their issues and challenges is very critical in preventing the spread of the pandemic, but also extending services. Just as I close out, I did work on an urban HIV/AIDS program many years ago, which was targeting commercial sex workers in Kampala. And part of what I discovered in our entry engagements is that they hardly had any community-based or peer education programs that existed within that structure. And therefore, every time you try to create a structure that is outside the structure of the people in which they live, it becomes resisted. So I would love to see community health structures live and functional in the urban centers, and that then become the vehicle and the fulcrum for us to do demand generation, primary prevention of COVID, and the access to vaccines.
Robert, I have my tweet, which is awaken the community health systems in cities. I think that's a clear message that is coming from you. Very, very helpful. Thank you for that. Professor Nazmul, what is missing? What should we investing on in cities to better prepare and respond to future waves of COVID-19?
Thank you. Thank you for asking me the very important question. You know, in a developing country like Bangladesh, lots of people living in the urban areas. And some of them are migrants, some are temporarily migrated, some are trying to migrate permanently. So we have different social strata, different types of jobs, different types of involvements. So challenges are great in the urban areas, and what is missing? What was missing during this pandemic? You know, during the first wave in Bangladesh, urban population were mostly stricken by the COVID-19, and later on, of course, the rural areas were also involved. In the urban setup, we have lots of tertiary level hospitals, lots of medical colleges, but likewise in the rural areas, we have community clinics, we have union sub-centers, family welfare centers, we have Upajala Health and Family Welfare Center, Upajala Health Complexes. There is a very beautiful infrastructure from the grassroots to the sub-district and district level. In the urban areas, a major portion of the primary healthcare and other service deliveries are provided by the local government and rural development ministry, along with the NGOs and other development partners. During this pandemic, some of the facilities were badly stricken, badly hit, and we believe the urban health structure for combating this COVID situation, it has to be strengthened. And the primary healthcare setup, which is beautifully set in the rural areas, so with some modifications, these sort of centers are to be established in the urban areas with the help of the development partners. Even the private sector can come forward to establish all these centers. Some sort of centers are still going on, they're doing fine. But as the number of people are increasing in these urban areas, so we need to strengthen these urban areas so that we can combat very, very efficiently. We can move fast if the third wave or the next wave comes. And we are preparing and we are organizing things for these coming waves. Over to you.
Thank you, Professor Nazmul. Martina, Ainur, would you want to add in terms of what is missing? Martina.
Yes, I would very much like to add on what was said. It's completely understandable that you both, Robert and Dr. Nazmul, mentioned the direct healthcare, and I was glad to hear from Dr. Nazmul that he mentioned also we have to be prepared then for the next situation, and that's what I would like to stress on and add also at this point. We need to learn from the experiences and to be better prepared for any other crisis to come in future. And that is what, in general, urban resilience is made of. And unfortunately, to reach urban resilience, that's such a broad topic that needs time. And in a case of a crisis, of course, you don't have any time to prepare anything. So that should be a lessons learned. To now take the learnings and to set up, as also it was done in Bangladesh, to prepare plans and be prepared to set up systems, to set up methods, how to react then better in the next case. So and what I would like to stress on also is the important communication part. Also for this, you have to think how in the respective city, in the respective country, the best situation can be established.
Thank you, Martina. Ainur?
Yeah, I would like to say that we need reliable, inclusive, and accessible data. That will much better data that will help us to identify vulnerabilities more correctly and faster. That proved to be the case, I think, in COVID-19. I'll give an example. While there are obviously common denominators of vulnerabilities like poverty, lack of access to services, living in high-risk areas, but we found out that there are some vulnerable groups that we may not necessarily think about. People who may be financially secure, living in a nice place, but completely isolated, completely lacking access to social support systems. They prove to be the have highest vulnerability. And this is not just only related to COVID or pandemics, but for example, extreme heat, which is the silent killer and becoming more and more one of the biggest and more frequent disasters affecting not just urban, but heavily hitting cities definitely hardest. But those people doesn't always get our attention. And so we need much better data. And we also shouldn't expect this data come from somewhere. We should get better in producing this data, primary data, and also get better at using secondary data that is available. But this data has to be, I would like to stress it, inclusive and accessible. There are some data, but sometimes we don't have access to it. And a lot of times the authorities, city or national authorities, don't have access to the data that, for example, in informal settlements, or type of data that we collect at the community level, so that they don't really understand what it means for people, how it affects their life, and while they might, kind of identify hotspots and see the vulnerabilities in a big picture, but still they also need to understand very granular of these vulnerabilities, and we have to get better at spotting the hidden vulnerabilities as the topic of this conference much faster and more accurately. Thanks.
This is a critical point, Ainur, and thank you for raising it so clearly. The access to inclusive data and reliable data to identify vulnerabilities has been central. I wanted to ask a question to the panel about the role of digital. A couple of you as mentioned, I know you mentioned digital tools for I think for volunteers management, and Professor Nazmul mentioned the use of digital in vis-a-vis I think telemedicine consultation. Yeah. That's what you were mentioning. Digital was and is by many brought up as the solution, or a big part of the solution. And I would like to hear your reflection of how much this has been the case from where you sit, and how much do you see the potential for digital health and engagement at digital level as a tool for the future, and whether the Red Cross Red Crescent should be investing more around this, and how. So big question. I'm not directing to anybody who wants to raise the hand. I would be happy to give the floor to. Professor Nazmul, please.
Thank you. Actually, not only during pandemic, access to data, access to information, we believe this is human right, this is fundamental right, and we are trying to make things easy for our people. We have created a dashboard. We have management information system. This dashboard is open for everyone, and every data you want to get, you can get it from there. Data is very important. Clarity of data is very important, and access to information is much more important, not only during this pandemic period. It is throughout the year. We need to share. We need to share data. We need to share experiences, but we must keep it in mind that digital divide is also an important factor, because you need to have internet access. You need to have Android or something like devices, so that people can use all these devices to get the information, the data. So we are working on it. We are working on it, particularly in the hard-to-reach areas. Telemedicine is very popular. We have very well-set telemedicine services in the sub-district levels. And these centers are connected to nearest medical colleges, nearest district hospitals, and sometimes whenever it is required to the postgraduate institutions, so that they can have the best possible service through telemedicine. And I believe digital medicine or telemedicine will be the future. And this pandemic has also created an opportunity so that we can use this platform globally, so that we can invest not only nationally, internationally, to share, to help the across the globe, so that people in general, they get the best possible Medicare, and so that we can reduce the burden. Over to you.
Thank you very much, Professor Nazmul. Martina, is GIZ having this element included in the approach, innovative approach moving forward? So how is digital faring into the equation for you?
Yeah, thank you very much again. Well, the topic of digital use is very broad, and I try to structure my answer a little bit for different levels. Firstly, what was mentioned for collecting data and preparing data for information, I think you can't do without digital use. That's for sure. One example, which was very positive after the tsunami in Southeast Asia, I don't remember exactly the country, but there was one country, they prepared a very good early warning system, and this could even now be used in the COVID pandemic situation. So this is a good support of a digital programming and system. Another example is that also we as a sector program, we have also developed a tool which is called City Works. And this can also help cities and to better systemize their disaster preparedness through a digital method, which systemizes the data collection and also analyze needed actions. So this is more for the part of create preparedness. The other topic is how to use digital devices in or after a crisis. Of course, also it's easy often to use mobile phones. You can reach people out. You can distribute information as long as there's electricity. And this is again a limitation of digital support. When there is an earthquake, then you rather have no electricity, and then you should still have also other systems in place. And this is what I would like to stress on. The digital solutions are not the one and the only solution. So you have to prepare for different settings. Yes, that's what I wanted to say. Thank you.
Thank you very much. Ainur.
Yeah, these are really great points. I totally agree. I want to maybe mention something about this digital services, that the two-way nature of it. So far, I think it's my personal opinion, I may be not completely right, but so far we are good or getting better at one-way digital services in terms of sending SMSs, sending warning messages, maybe offering digital trainings online, and now getting better at these conferences. And I see that we will get better. But we have to remember that to be truly effective, we have to think that it is two-way. Are we equally good at listening people or getting absorbing what people are saying? So that is a tricky thing, though. Like I really think it's not that easy, because as we know from social media, there's a lot of chatter going on, a lot of things going on. But we have to get better at really making sense of what people are saying. So this invest in this listening part two-way. We have to think of it always as a two-way communication to be really effective. So what I would say is that our digital services or whatever we do digitally has to be truly, our success will be measured whether or not we are increasing, we are making people feel more connected and listened. That's where, we would feel like whether or not we are successful. Thanks.
Thank you for this point. I love it, because it's digital technologies that do not connect people are not helpful. And I was thinking about some of the failures that have happened in the contact tracing apps in different parts of the world. They were missing the human touch. People were not being heard, and that's why in many places those contact tracing apps that in theory could have helped, particularly at the beginning of an epidemic, didn't really work out. So I find that a critical point. And I think you brought back the issue of information and misinformation, which had been surfacing through the various interventions by the previous speakers. I'd like to go back because we are all over the world facing a crisis of information. For those of us who are sitting in Europe, now that we are seeing a fourth surge, we are seeing how much resistance there is, how much misinformation is there, and is taking to the streets. I mean, there are riots actually happening. I wanted to ask you, maybe I'll start with Professor Nazmul, to share your experience, your challenges around the information during what is now almost a 2 years crisis, and what lessons have you taken from your experience over the past 2 years that we can use for the rest of these pandemics and for future emergencies around misinformation?
Thank you very much for this important question. Definitely, it's a very tough one to answer, because information is sometimes essential for service delivery. Sometimes, you know, in different country perspectives, you cannot get all the information what you want to get. And in our country during the pandemic, we were free. Everybody were free to ask any question, to get any information. But still, information for whom? For the people. Information for whom? For the citizens of the country. And they had to have all the devices, all the media, so that they can have this information. And you know, there are some hard to reach areas, very difficult to provide information to them. But we are trying to overcome all these situations. You know, the telecommunication network is beautiful in Bangladesh. Different operators, government and non-government, they are playing in this field. And out of 170 million people, at least 120 to 130 million people have some sort of cell phones or devices like that. And during this pandemic, everybody in all the sectors, in schools, in colleges, universities, in government offices, non-government organizations, everywhere, everybody were somehow connected with the help of internet and using different sorts of platforms. So we are working on it. I shouldn't say that we have done everything excellent, but we are right on track, and we are trying to do. And I believe as time passes, from our experiences, we can do better. Already we have identified so many sectors, and we are trying to improve all these things.
Thank you. We are 10 minutes. We have 10 minutes to go, so I will give the last chance for our viewers to put questions in the chats. And I will bring these questions up at the end. I have one question that is for all of you, that is bringing this all back to Red Cross, Red Crescent. It has been an incredible experience, I think, for all our national society that have responded to the crisis, that are responding to the crisis in an unprecedented way, being called by the governments to act well beyond what they were used to, and I think strengthening those linkages that hopefully will build that resilience, Martina, that you were talking about, that really cannot be built during emergencies, but certainly emergencies help to realize the needs and identify critical actors and build on them for the future. And I would like to come back to you all to ask a piece of advice specifically for the people that come from the Red Cross, Red Crescent, that are sitting with us, on what we, and I use the word we because I still feel part of the family, what we could do to be better in both on the preparedness side and on the response side, to be more present, more efficient, faster, bigger in numbers. I don't know where you're coming from, but some piece of advice that we can take with us. And maybe I'll start with you, Ainur, since you are within the family. So some self-reflection from your side.
Yeah, thanks, Emanuel. I think one thing is very obvious that COVID showed that the COVID was a local, completely almost local response. So that showed that when needed, local national societies can really step up to very, very challenging tasks. But it also showed that the importance and critical role of local action. And I would like to believe that maybe encourage all these discussions during the COP26 about locally led recovery or locally led adaptation. I would like to think that. But my hope and advice or recommendation, whatever it is, that let's just grab this. It is an amazing moment. We shouldn't waste this. We shouldn't waste this, and we should just keep pushing for locally led disaster risk reduction, locally led climate change adaptation. That showed what we can do, and we shouldn't let this go and really make ourselves, especially in cities, a critical stakeholder and even a leader in making cities more livable and sustainable. Thanks.
Fabulous. Hard to follow this. Martina, would you like to share your advice for us?
Sure. I mean, the experiences we made, I would like to come back to this again. I start again on a very global level, or on a very general level. So I would like to address the governance as such. We need governance in place, also in Germany, because as you maybe saw during our flooding crisis mid of this year, also Germany could not react in a perfect way. So please don't get me like I have the golden and silver spoon and best ideas here. But I think in general, governance is a very important topic. So we need on the different levels a good system which also has the chance to react quite flexible. So usually governance is very, very strongly regulated, and even in a crisis, you see you need more flexibility. And what is also important is financing. That's a topic we have not discussed in depth. So means we need, coming back to governance, clear mandates on the different levels, and also access to finance, because you can only act. And as you can see in crisis, you have to act locally. Then the local level needs also the means, and this is finances to react fast. And another point is that we still have to remember how our discussion also started, that it's a complex situation. So I would like to come back to the three dimensions of resilience. That one has to remember the economic, the social, and the green dimension of resilience. That's complex, and therefore, again, it's very important not thinking in silos, but to think integrated and cross-sectoral, and work also cross-sectoral to establish cross-sectoral networks. That's easily said, not so easily done, but I think these are some principles one should have in mind. Thank you.
Thank you, Martina. Professor Nazmur.
Thank you. Thank you. Actually, COVID-19 pandemic is not the last pandemic. We do not know how many will come and how many will stay. But whatever we think, we should think globally and we should act locally, engaging the local communities. Local communities' involvement and engagement and empowerment is essential to combat any sort of calamities. In Bangladesh, we used to face lots of natural calamities like flash flood, like tornado, a cyclone, etc., etc. And we have a very good disaster preparedness and response mechanism. We believe engaging the communities, involving the religious leaders, politicians, social workers, NGOs, and all other development partners, and financing them properly, train them and retrain them regularly. And if the national organizations like Red Crescent and Red Cross societies, if they are involved, if the volunteers are extracted from the community, we can have very good result, whatever may be the calamity, whatever may come in the years to come. If we think globally, if we act locally, and if we extend our hands, we can finally win over all these sort of calamities. Over to you.
These are very important words, which I would like to use basically to close this fantastic session. The think globally and act locally, I think, has been embodied by all your interventions today, with the difficulties of making that happen. But I wanted just to mention a few things that I take with me from this discussion on the act locally, which is critical. The importance of data, inclusive data, reliability data, to identify where vulnerabilities are. That is critical. If we don't know where the vulnerabilities are, we are not going to reach the people that are in greatest needs, and that is clearly an area to continuously work on. We have talked a lot about the informal sector and the role of the informal sector. It was very interesting from Robert's presentation to see the many ways the informal sectors can really be relied upon in cities. He used the words private sector runs the city. And so I think in some places really, governments and private sector dialoguing much more. This goes back to your cross-sectoral point, Martina, of really bringing down silences and bringing people together. The issue of local leadership is important in cities. And again, we talked about different type of leaders, formal and informal, that need to be involved throughout the process. We talked about the role of digital for the present and for the future. We talked, I think we came back over and over again to the fact that really is awakening, and I go back to Robert's words, awakening the community health system in cities is a critical element moving forward. To respond, but most importantly, and to me that is my personal final take-home message, is to really start building that resilience that is critical, not only for this pandemic, but for future health emergencies and other emergencies that will come. Many linked to climate, but not only to that. And on that, we really need to think about a resilience that is green, that has an economic element, that has social element. And I think within all this, the Red Cross, Red Crescent national societies have a critical role to play. They have played it well in many countries. We need, I think, to strengthen the linkages between the national societies and the respective governments to codify better what the role of national societies would be, to increase, again, to use your words, Martina, having a stronger governance with stronger flexibility, if that can is not an oxymoron. And I think those plans are entering those plans and ensuring that Red Cross national societies are recognized as actors codified within the emergency structures and emergency response systems and the preparedness systems in each country will be super important. So with that, I would like to thank first and foremost my panelists. Thank you for your time. Thank you for your insights. It has been a fabulous interaction. I would like to thank the organizer, the institutional organizers, the German Red Cross, the International Federation of the Red Cross, and with the support from the German government. I would like to thank personally Hans Ebbing, who has been organizing this session, has been working behind the scenes, but making it a success, which I hopefully you recognize as such. I will also remind you that we will have next sessions with videos, including a simulation for the Philippines earthquakes, and then The following session will have a focus on MENA cities and civil society's engagement and learning from disasters. So please do stay with us. And with 30 seconds to go, I just give you time to go and have a coffee, tea, or do whatever you need to do after this. Thank you so much for being with us. Enjoy the rest of the day. Have a good evening, good afternoon, and a good day to all of you. Thanks again from all of us. Bye-bye.
Bye-bye.
Thank you very much. Bye-bye.
Bye-bye. Stay safe and